Okay, whenever you're ready.
All right, thank you. Okay, Chapter 9, Sexual Assault, Tahlea, Hope, Logan, and Maddie. The scope of the problem. I started with the definition that the book used for rape, which is an unwanted act of oral, vaginal, or anal penetration committed through the use of force. Sexual assault refers to a broader range of sexual criminal offenses such as sexual battery and sexual coercion, up to and including rape. The scope of the problem for rape is underreporting. 50% to 90% of all rapes or attempted rapes go unreported, some because of shame, humiliation, guilt, cultural taboos, and the fear of secondary victimization at the hands of medical and legal authorities. The dynamics of rape. Cultural and social factors are gender inequality, pornography, social disorganization, legitimization of violence, and the vast majority of rapes have to do with the power relationship between men and women. Some men, some males who feel such absence of power and control in their lives, they develop a need to take control. Some myths about rape is just rough sex, rape is motivated by lust, victims or survivors of rape prov- provoked the rape or wanted the rape, so no harm was done. If the woman doesn't resist, she must have wanted it. Boys and men can't be willing victims. If a boy or girl experiences sexual arousal or orgasm from abuse, this means they enjoyed it. There are many more. Date and acquaintance rape. The use of a date rape drug and commission of a sexual assault constitutes a premeditated or deliberate assault. It is suggested that sexual abuse is an underlying risk factor for both heightened sexual activity and sexual victimization in dating. A myth about date and acquaintance rape is date rape isn't really rape. In order to prevent date, acquaintance, and other forms of rape, is continuing educational and support services are critically needed to address in an culturally unbiased manner the causes and prevention of date and acquaintance rape.
And then for intervention strategies for rape and battery, following immediate aftermath of the crisis, the most helpful and appropriate response from a crisis worker is empathy and assurance that the survivor is still alive. This provides the core facilitative functions, which is building trust, displaying unconditional positive regard, using empathetic listening and responding, providing concreteness and clarity, and demonstrating patience. It is crucial to build a working alliance, which is a cooperative and trusting working relationship between an interventionist and a client. During this time, a kaleidoscope of emotions, thoughts, and behaviors may occur during the impact state, which occurs during the assault and for approximately 2 weeks following it. The client may be in a state of shock and dissociation. It is paramount in restoring sense of safety and security through maximized sensitivity and assuredness of the crisis worker. Immediate aftermath, there is no universal reaction to rape. Women may exhibit a wide variety of responses to the rape and the subsequent recovery. The crisis worker's job is to continuously provide support, safety, and practical assistance. In psychological first aid, it is the first order intervention that seeks to address the immediate crisis situation and provide immediate relief, possibly to a wide range of individuals. And this compromises 3 primary tasks of the intervention model: predispositioning / bonding, exploration / assessment, and safety. Utilizing support systems as well as stopping secondary victimization is crucial. Individuals in the support system might either become homicidal or blame the survivor for the rape. The following 3 months, topics including critical needs, critical support, and the potential for PTSD need to be addressed. And then adult survivors of childhood sexual abuse. Sexual abuse of children wreaks lasting damage in their lives that continue into adulthood. child sexual abuse has been shown to predict the development of PTSD in later life. False memories occur for 3 reasons: countertransference. Angry adolescents who are seeking emancipation lash out at their parents by making accusations of sexual abuse. The child who projects her own strong sexual feelings onto the father as his own toward her. And then studies by Bremer, 1998, have raised doubts about the degree to which traumatic memories are susceptible to distortion due to misleading and suggestive statements.
There are 3 main treatments we see older adults use. These are post-traumatic stress treatment, CBT, and EMDR. Post-traumatic stress treatment uses both prolonged exposure and cognitive processing or reconstructing. This method is used the most for people who have regular PTSD from their assaults. EMDR stands for the eye movement desensitization and reprocessing. This is a psychotherapy treatment that was originally designed to alleviate the distress associated with traumatic memories. CBT stands for cognitive behavioral therapy, and this one is the most effective of the 3. CBT focuses on challenging and changing unhelpful cognitive distortions and behaviors and looks to improve the development of personal coping strategies to solve current problems. Some important terms I found for the intervention strategies for adult survivors along the way were psychoeducation, grounding, and mindfulness. Psychoeducation is evidence-based therapeutic intervention that allows the patient and their loved ones to know that these issues that they are experiencing are normal and that they are not alone. Grounding refocuses the clients on the immediate therapeutic environment. In other words, this helps them get back on track and makes them focus on the help they're getting and not the issues they have. Mindfulness. Mindfulness is a variation on stabilizing a person who is dissociating and derealizing. This is the art of relating to one's experiences and accepting whatever comes to mind. Support group for survivors. There are 5 main benefits of a support group treatment for childhood sexual abuse. The first one is you lose a sense of shame by seeing the other people who have gone through the same thing. 2, it helps normalize the problem so can become more aware of it. 3, a family bond is created with the group so you feel safe and willing to work on your issues. 4, you can say what you've been holding in for so long. And 5, you can challenge the rules that were created in your abusive environment. Some saddening statistics about childhood sexual abuse are 1 in 4 girls and 1 in 6 boys will be sexually abused before they turn 18. 34% of people who sexually abuse children are their own family members. And 12% of women and 28% of men are ages 10 or younger at the time of their rape. There are 6 phases of childhood sexual assault. The first phase is the engagement phase. This is the phase where the abuser tries to get the child involved sexually. Stage 2 is the sexual interaction phase, and this is the phase where the sexual activities actually begin to occur. 3 is the secrecy phase. The abuser tells the child that this must stay between them and that nobody can find out. 4 is the disclosure phase. Accidentally or purposely revealing what you've gone through. 5 is the suppression phase. And this is when the abuser, the family members, or professionals downplay the experiences you've been through. And 6 is the most important phase, and it's the survival phase. It's when strategies to help the child and family begin to be implemented.
Intervention strategies with children begins with assessment. This includes thorough documentation of abusive events for possible legal use. And then Peterson and Hardin developed a guide for screening children's art for sexual abuse. This is denoted by 3 actions. It's the child is asked not to verbally disclose, but rather illustrate different subjects and situations, and point values are awarded to a variety of criteria commonly found in abused children's drawings. And then 3, once the point value reaches a certain level, childhood abuse can be suspected. Therapeutic options for dealing with intervention strategies with children. There's 2, it's play therapy and cognitive behavioral therapy. In play therapy, characteristics children may manifest is developmental immaturity, opposition and aggression, withdrawal and passivity, self-deprecation and self-destruction, hypervigilance, inappropriate sexuality, and dissociation. In cognitive behavioral therapy, psychoeducation with emphasis that the child is not isolated or alone. Behavioral reversal and modeling skills that are taught to the children and non-offending parents to teach them how to regulate emotional expression and develop new cognitive coping skills. And then relaxation training and graded exposure treatment to the trauma that allows the child to learn that his or her fears and avoidance of the feared situation, object, or person are not nearly as frightening or upsetting as previously thought. A traumatized child has difficulty regulating emotional and behavioral states, and the social environment and system of care are not able to help the child regulate their emotions or behaviors. So, if the principles of treatment, if the system needs to be changed, are denoted by 10 actions. The first is to fix a broken system, not just the identified client. 2, put safety first. 3, create clear, focused plans that are based on facts and target specific components of the child's emotional dysregulation and the level of instability in the child's environment and system of care. 4, don't go before being ready. 5, use resources to gain maximum benefit. 6, accountability is critical. 7, deal with the reality of the situation. 8, take care of yourself and the treatment team. 9, look for strengths in the system. And 10, leave a better system. So the third action is the need for affirmation and safety. Affirmation and validation are crucial in regard to what has happened, what is happening, and what will happen to the child, the offender, and significant others. 4, regaining a sense of control. Anger and grief are emotional byproducts. Venting is very important during this stage. Play therapy techniques give the child a renewed sense of empowerment, as well as venting. 5, education about sex offenders and sex itself is important for children because they have little knowledge, if any knowledge, of why and what has happened to them. It's important during this stage to emphasize that the adult has made the mistake and not the child. And then finally, assertiveness training. This is for the future since children are at a greater risk of re-victimization, it's important to teach them cues and warning signs and appropriate assertion responses so they can avoid future abuse. Next, we're looking at prosecuting the perpetrator. This begins with interviewing the child. A skilled professional that is trained in obtaining evidence and making children feel comfortable while obtaining this evidence is important so that they feel comfortable and are willing to provide information. 2, preparing the child for testimony. Most of the time during rape cases, a child will need to appear in court, and that can be pretty scary. So in the book, they use the Carl Perkins Center as an example of what they do to prepare children for this kind of situation. So they use puppets, books, and videos to educate children on what testimony in a courtroom entails. And then the child and family are kept at the center until a call is received that court is about to convene. This is just so they don't have to sit around all day and that they don't get stressed or have too much anxiety. And then finally, after the court takes place, the center stays in touch with the family and child for at least a year. And then 3, aftermath. Any child who has been sexually abused needs counseling, and the problem should not be addressed through family therapy. Counseling after any event of sexual abuse is very important. Universal characteristics such as lying, stealing, fighting, verbal and behavioral oppositional defiance, and promiscuity are typical aftermath behaviors that assail children who have been sexually victimized. Boys perpetrate sexual assaults on other children, bully other kids, vandalize property, and generally direct their anger outward. Girls typically turn their anger inward and engage in alcohol and drug abuse, eating disorders, and promiscuity. In group counseling, peer interaction leads to expression of shared feelings and bonding and a higher self-esteem. This is just important to create a comfortable environment where they feel comfortable sharing information about what's happened to them. And then during counseling, it's important to reestablish personal and interpersonal boundaries. Intervention with an abused child should never occur in isolation, but include other non-offending family members. It's important to establish safe therapeutic ground by the crisis worker, just so that everyone feels comfortable providing information. Drawing or constructing a bridge. This action is mainly used for assessment to determine where people have been and where they are going, and transcending. This is noted as the last session phase of individual counseling and sexual assault therapy. And this is when the caregiving parents and the abused child are brought together in conjoint therapy. And this is just so everyone can process through what has happened together and they can decide how to move forward. And that's the end of our presentation.